I'd like to welcome everybody back today. We have the pleasure of having Miss Bernita Wardlow and Miss Pamela Melton, who are social workers at Children's of Alabama. And we're glad to have you guys with us here today because March is Social Worker Awareness Month, and we want to highlight everything that you guys do and acknowledge the work that you both do. And at this point, I'd like to hand it over if you would both introduce yourselves.
Yes, I'm Bernita Wardlow. I have been here at Children's for 27 years as a social worker. My primary area I work in is rehab medicine and neurosurgery, and I enjoy my profession.
Now, are you originally from Alabama?
No, I'm from Mississippi, via California, via Georgia, and then I finally landed here in Alabama 27 years ago.
So you got to see the whole South of America then.
Yes, I did. I love to travel.
Heck yeah. And Miss Melton, if you could introduce yourself.
Yes, my name is Pamela Melton, and I have been a social worker for 19 plus years. I've been at Children's of Alabama for over 7 years. And my area of specialty is neurology and orthopedic. So the patients and the consumers that I follow are neurology, which is epilepsy, cerebral palsy, orthopedic fractures, conditions. That's the area that I follow, or the patients I see.
Are you originally from Alabama as well?
I am. Birmingham, Alabama.
Birmingham, Alabama. I was just going to ask, which is your team? Now, when you both kind of went through that, you said you have more specific focuses with the individuals that you help, whether it's more neurological and epilepsy there. Is that something that you trained for before becoming a social worker, or is that something that you learned kind of on the job?
Well, being a social worker, that covers so many facets. When you're a social worker, you wear many hats. So the training that you receive for to become a social worker is a generalist approach. So no, we didn't have to get specific training on seizures or cerebral palsy. Our profession is what helps us to be able to assist our families in the specific services that we serve under. So along with Bernita and myself, there are probably 30 more social workers. We all are assigned to a different unit here at Children's of Alabama. So we have social workers that see rheumatology patients. We have social workers that see the HEMOC or the cancer patients, and so forth and so forth.
And probably one of the busiest units here is the social worker that is assigned to the emergency room. Those are the just occurred acute injuries that come into our trauma base, and then we process those patients from their injury to the Internet hospital until they discharge into the community.
Now, you said there's quite a bit, about 30 social workers at Children's with a wide array of focus there. If we could take a step back for anyone not familiar with what social workers do, if you could give us kind of a broad introduction.
We can do that. Social work is a profession that's devoted to helping people function the best that they can in their own environment. So that's basically in a nutshell. And I hate to say nutshell because social workers do so much. But for others who are not familiar, that will kind of give them an understanding of what a social worker does, or what a social worker, and not just in the hospital. Social workers are all over. There are social workers in the political field. There are social workers that work in nursing homes all over. So not just for the hospital, but just to give a brief summary or definition, that is what a social worker is. We are devoted to helping, or we have provided a commitment to help people and families in their environment to be their best.
I like the language you use there of their own environment. That's language that we're hearing around the community now, and is least restrictive environment, their own environment, community living, stuff like that. So you guys are seeing that on your front as well.
Definitely. Yes. Every day, all day. Yes.
Now, if someone was interested in becoming a social worker and was, in high school or thinking about going to college, are there certain educational requirements that are necessary?
Yeah, you need to seek an accredited university, college or university that offers a social work program that's accredited through the Council of Social Work Education. And beyond that, once upon completion of that program and reception of your degree, you really need to strive to get your licensure, because that opens up a whole world of different avenues that you can pursue, and you won't be so restricted. I'm sorry.
My phone was just going off. I had to do the same thing.
I'm so sorry. I forgot to did in preparation, did everything but turn the phone off.
So definitely, if one was interested, they would need to receive a bachelor's or BSW from an accredited university or college. From that, that's more so the minimum. If they wanted to advance or go into a higher level, that would be a MSW or a master's in social work. And that will also come from an accredited school for social work. And then, of course, in order to say that you are a social worker in the state of Alabama, you must possess a license. And that is a test or an exam that you have to take that's through the Board of Social Workers. And you have to pass that test in order to say or become a social worker.
Is it a pretty hard test? Like, do you study for it?
Yes.
Yeah, I imagined.
And the questions on there, you would think that you are prescribing medications, psychiatry. Yeah. I mean, it was quite difficult. And by me not being a practicing social worker prior to me taking that exam, I was very overwhelmed, but I was prepared through the University of Alabama's program. I was prepared to take that exam and was able to pass it on the first try, thank God.
Oh, congratulations.
It was not easy. And if you let your licensure lapse, you have to repeat that exam over again. That would never happen in my lifetime.
I hate taking tests. I freeze up. I can do okay outside the classroom, but when they sit like a multiple choice test in front of me, I freeze up. Can't do it.
Yeah, with hundreds of questions. It's not just simple. It's hundreds of questions and all the answers appear correct. So you have to be very careful and thoughtful in your selection.
They try and trick you.
Oh yeah,
I think it could be this one or this one, and there's like one word off, and I hate
exactly.
Now, what do you see in the industry? Do we need more social workers? Would you encourage someone to go into the profession?
I would, but you have to have pretty thick skin, and you have to be mindful of people and where they are in their lives. Everyone's opinion is valued. Everyone's lifestyle is different. You have to be accepting of others' thoughts and what their belief systems are and support that. So you can't put your belief system onto your client's belief system, because if you attempt to accomplish that, then wherever their problems are that has you involved with them in the first place, they are not going to be as encouraged to reach those goals that we're going to set forth within our assessment module to help them achieve what they're trying to achieve.
Now, what do you mean by belief system there?
We're all different. We are different political views, different sexual orientations, different belief system, and how we should handle our beliefs and who we feel like we are internally. And you don't go and try to change someone if they're trying to become comfortable in whatever their belief is. You try to do what you can to show them their strengths and how they can be confident in whomever they are.
So it sounds like kind of leaving.
That's where it goes back to in their own environment.
It sounds like leaving a lot of stuff at the front door when you walk in and focusing on the challenge of the day for that individual.
Correct.
Almost like a scientist where you're just walking into a lab and it's like you have this challenge in front of you and nothing else matters at that point but helping this individual overcome this challenge today.
And then number one thing we do is link them to whatever resources that's within the community that would make them help them achieve whatever their goal is.
Now, what is a
And
day? Go ahead. I'm sorry.
being a social worker, you're always looking for resources, and you have to be strong with resources because we have so many families and clients or consumers coming to us that require various types of needs, various types of resources. So that's something that we're always having to assist with is resources and support systems, and having to know those things that's out there in the community to assist or to assist those families.
Yeah, I feel like if you're in a great environment, you feel very comfortable, everything's going smooth. But if you transition and you go either back home or you go to a new environment, it can seem kind of scary. Like, oh, it's not going to be the same. I'm not going to have those types of supports. So making sure that that transition is smooth would be a big thing for me if I was an individual or a family receiving services like that.
Mm-hmm.
Yeah,
Correct.
definitely. And particularly here on our rehab team, we try to mimic the home environment the last few days prior to discharge. The nurses become more hands-off, and we put it in the hands of the parents to walk through from the time they get up, medication administration, dressing, feeding, all the way through the day. So if there are any issues that they are not comfortable with, we can address those issues here in the clinical setting versus them going home and panicking because this or that didn't go right. So we put the whole last 3 days in their hands, and we're hands off, and they just let us know when they need our support. And that way it builds a sense of confidence prior to them going home that yes, we can manage this. And we also have the Ronald McDonald House accessible to us, and we can discharge them to the Ronald McDonald House at times and then bring them over here, which is across the street. And then that also mimics a day in the community or in your home, where if you had any problems that morning, getting over here from the Ronald McDonald House, we can address those issues and then practice those skills to make sure that they become more confident and comfortable in achieving whatever it is they had those issues with.
I like
And
how
then,
you.
and then if that's not enough, we have resources such as the health department that can go into the home several times a week and assist with the care in the home. There are other resources, as mentioned before, such as Children's Rehab Services or Alabama Department of Rehab Services that will go into the home and make sure that a physical therapist is able to assess certain situations, looking at how the parent is going to now try to bathe a child that has this disability, making sure that the home is accessible. And that could be another thing. They've been here in the hospital with these widened doors, but when you get home, that could be something totally different. So we have those resources that we can send to the home and be in the home environment with those families.
I feel like that's a huge part, and I like how you guys get the last 3 days of the stay back kind of on the hands of the parents so they can get the experience there. What are some challenges that you see there? Because I feel like that's a very integral part, but some families may be nervous about it or kind of hands-offish. What are some of the biggest challenges that you have come across in those last 3 days?
Some families, parents are not as comfortable with hands-on involvement with their child's care. They aren't comfortable with the diagnosis in the first place, and they are very in the corner, kind of looking around at what the nurses are doing or reading a book. Or some of the younger moms, we have to encourage them, look, you need to stay off your cell phone. This is an educational opportunity for you. You need to get in here, get hands-on with the nurses, get involved, because when you get home, you aren't going to have this staff to rely on. And so we strongly encourage them to, prior to that, if we do see that that's the characteristics of their personality, try to find out what the issues are. Why is the cell phone more important than you learning how to manage your child's care? And then once you present it like that, then it kind of opens their eyes and they become a little bit more involved, and or they express what their fears are, and then we can work through those issues as they're presented to us.
It sounds almost like being a therapist for for parents through the process.
Yeah, yeah. The nurses and the team, they pretty much work with the kids. But us, the social workers, we really work with the families, the parents, the adults in the situation. And sometimes, unfortunately, the adults that are responsible for their welfare are the reasons that they wind up here due to their inadequacies or misjudgments or poor decisions, which caused their child to be here in the first place. So sometimes we have a lot of barriers and they come here very resistant, and we have to break down those barriers as much as possible because we are the link between them and the medical staff.
Mm-hmm. Oh, I always say I have a family member who is 57 now, and she functions at about a 3-year-old level. And she has a caseworker with Region 5. And I always say to any other parents that are looking at long-term care and they have questions, I say, you need to have a great relationship with your son or daughter's case manager, because they are the link to the rest of the state and the resources available. So you should be on a first name basis. Call them, text them, email them, whenever you'd like. Just to check in and make sure you're still on the radar for things.
Exactly.
It's the lifeline there.
Yes, definitely.
Now, if you guys could give us kind of an example of a case start to finish, something that we could anchor with.
Level 1 trauma comes in from a catastrophic event in the community, multiple injuries within the community. And we sort through, sometimes we don't have an identity. In this particular case that I'm going to focus on, the parent did not survive the incident. So the child came in as Jane Doe, unaware of who he was, along with multiple other children who also came in as Jane Does. And so we write descriptions down and where the paramedics picked them up from, so we can kind of narrow down a location. And we try to match the kids with the adults that come here looking for children. So, we try to match hair color, size, the height, and etc. And then try to come closely as possible to the children that these people are describing to us. Once we're able to link those kids to their families, of course, we provide support, whatever is necessary, to the surviving parent or to the parents, and make sure that they are comfortable. We know where everything here in the hospital is. It's a huge facility. So we try to make sure that, because we are aware that this will be their home for the next few weeks, if not for the next year. Things that are around in the community that can be easily accessible. Fortunately, we have a grocery store that was built downtown, so they can go and get needed supplies, restaurants, and just in a nice park nearby where they can go and relax and kind of get away and step away from this setting whenever it's necessary. So Railroad Park is right up the street. And we link them and the medical team together so that everyone is on the same page. We have a team meeting at times. They round every morning and we address the parents' concerns and we give them updates as to the progress that's being made or the issues or the challenges that may arise as the days go on, whether or not they're, some kids do not survive. And for those that do, then we try to meet the parents and try to see where they are in the challenges. We prepare for the worst and we pray that the children will get better. So we practice for the worst case scenario at home, and then we back off as the child progresses toward getting well, functioning at a higher level than they were when they arrived here. We meet with them 2 to 3 times a week, sit down with them to make sure that whatever fears or challenges that they have, we address those. We link them to community resources when necessary to make certain that whatever their needs are, they can be met within the community. We have some partners here at the hospital that partner with us and help people who are going through different scenarios. help them pay their bills so they can remain here with their children without the added burden of wondering, how am I going to pay my power bill? How am I going to pay my mortgage? And I won't be able to go to work for 2 months. So those people that meet those qualifications that the organization set forth, then we'll make those referrals to those organizations. So at least the general household expenses can be taken care of, so it can enable parents to focus on their children and their children's health and well-being. So as we get closer to discharge, one family, the kids will start out in the emergency room. They'll wind up going to the pediatric intensive care unit until they can get over the worst part of their injuries or their illnesses. And then they'll do a step down unit for a few days, called a special care unit. And then when they are deemed necessary, when less medical intervention is necessary, then they will go to a regular room where the nurses can manage more than one patient at a time. In those previous units, that's pretty much one-on-one care, because a lot of them, in those units, the kids a lot of times are hanging on to life, and we're just trying to make sure that they get the most swift treatment as possible if anything starts declining with their health care. And once they get on a unit, we start planning for discharge. It might be a few weeks or a month down the line, but depending on the nature of their injuries, we need to know what size doorways, how many steps do you have? Because we may have to build a ramp now, because the child won't be walking back into the home. He'll be in a wheelchair. Some houses are on hills and there's no way you can put a ramp on there. So then we have to partner with the fire department or other local entities to try to determine who can help these people get this child in and out of the house for medical appointments or family gatherings or whatever. So for socialization as well. So have come up with the plan that'll take them through any scenario that they may encounter. And once we get toward discharge, then we check and see what barriers are still remaining that we have not addressed. Fortunately, within the 2 or 3 weeks, we hope to have addressed anything that may arise, but just in case, we just have to sit down, and sometimes we're able to send Children's Rehab Service, which is a state-based agency that helps kids once they get out of the hospital and go into the community. They can meet them at the home prior to discharge and do an assessment of the home, because they can go into the home one-on-one, whereas now we're basically hospital-based social workers. And then I guess the silver lining, we have a group Magic Moments. And if you qualify, if you've had a catastrophic event or life-threatening or life-altering situation, we make referrals to them. And that gives the child an opportunity, once they have cleared and their medical challenges are less severe, that they can go and have their dream, whatever it is that they dream of. We've had NBA games, NFL games, playoff games, trips, and most importantly to the little ones, Disney World. I have one there now that landed this morning and sent me a picture and said, "Hi, we're here. Thank you so much for the referral." So just to see the smiles on their faces, and Mickey and Minnie meeting them as soon as they hit the property, coming to their room, checking on them 2 or 3 times during their stay, whatever their favorite character, they get a visit to the room, ice cream and pizza and hot dogs and hamburgers 24/7 around the clock in a beautiful setting. And then to step outside and you in Disney World. And that just makes them just unforgettable moments. And then some kids don't want that experience. They want their room decorated. So it gives them their personal space, get their room painted, get digital, all the digital stuff that teenagers love, and have it right there in their fingertips. And that's a lifetime. They can come home in their room, and it's a memory that they have forever. So just to see them achieve whatever that wish is that's going to make them happy, it really is empowering. It gives you a good feeling, warm, fuzzy feeling inside, because all our cases don't make us feel warm and fuzzy, unfortunately. But that's why we have a job.
And again, through that process, the social worker has to be resource strong. Just by listening to Bernita tell the start to finish, she mentioned, she probably don't even know that she mentioned about 8 resources for one scenario. So that's where your social worker strengths come in at, knowing resources and knowing those things out there in the community to best serve your families and your patients.
Now, how do you go about learning through all those resources? Is it something that you have to stay on top of, or is the hospital like, hey, I want you to read through all these for this month?
No, that's something that the social worker has to do on their own. You have to be familiar with your surroundings. You have to be familiar with what's going on in your environment, in your community, so that you can best help your families when they're here at the hospital.
And
So
I imagine, go ahead, I'm sorry.
No, it's not anything that the hospital will say, here's a book to look through. Actually, social workers have provided a book or have made or established a book of resources to kind of help some of the newer social workers that come in, because they're fresh out of school. They don't know a lot of things that they can reach out to assist with resources. So we do have a manual to assist some of those newer social workers. However, but it's nothing that that's provided through your employer.
If I started, I would be hitting you both up, be like, Bernita, Pamela, I got no idea what resources, what do y'all got? And you'd be like, boy, you need to learn this on your own. Taking up my time. I got my own cases, my own individuals.
No, we are always glad and happy to help the newer ones become comfortable, because the job is to make certain that all our kids are provided for and their outcomes are the best that we can make them be. So
now you spoke a little bit, or you spoke about the entire process there for really an individual and for the family, their initial hospital stay. You guys are the go-to person for the family there. And I really took that the information flows both ways. So if the family has questions or concerns, you guys will help them and get that information to maybe some doctors or nurses. But also when you guys have these meetings and the doctors or nurses are telling you more about the child, you're then taking that back to the parent and reinforcing that and educating them on what that means there. So it's really a back and forth of information flow that you guys bridge.
correct. Sometimes the parents don't quite understand what the doctors just walked in and told them.
Yeah.
And then leave there and they have this questionable look on their faces. So it's our job to make certain that you gather everything that he was explaining to you, and then have them to repeat back to us what they took away from the conversation that they just had with the medical staff, to make sure that they are understanding what was just communicated to them. So,
and there are times where we are in the rooms with the doctors explaining what's going on with the child or what needs to happen in regards to the child's treatment plan. And as a social worker, you're looking at both parts. You're looking at the doctor, you're looking at the parents, and you can assess whether or not mom or dad or grandma if they're comprehending or not understanding. And so one thing that we do when we're in there, we're kind of like, well, Dr. Jones, can you explain that again to mom? Or, we're able to assess those things while we're in the room with them as well.
Yeah, because I feel like a lot of times I might be a little bit nervous to speak up and ask the doctor, like he just threw out a bunch, 15 words and I have no idea and I'm frozen. But if you guys see that, you're like, well, let's slow down here, doc, let's cut away from the medical jargon and just have a conversation here.
Exactly. And another thing, what helps is when you can put yourself in the parent's place, where you've been on the other side. You've been at the doctor's office and you know that this doctor's talking to me. I have no idea what this just, one-on-one personal. You have no idea what this doctor is saying. So being able to put yourself on the other side, and that helps with being able to generally help and have empathy and see, hey, they're not really getting this. This doctor just said a whole French probably sounds like French.
Yeah.
But it does help when you're able to put yourself on the other side.
And we also provide notebooks so that the parents can jot down questions, because sometimes things don't come to you until your brain relaxes in the evening. And then you're able to think a little clearer on when you go back and review your day. And so they can jot those questions down. And when the doctor's round the following morning, which they do every morning, sometime twice a day, they can address those concerns with the doctors and have them to go back and explain a little deeper what they were trying to communicate to them earlier.
That's an awesome idea to give the notebook, because that happens to me when I lie down to go to bed, and then I'm awake for like 2 hours, and I'm jotting stuff down on my phone all the time. It sounds, you mentioned that some children don't make it, and it can be tough for some cases. And the medical field in general, especially at children's and small children, I feel it can be a very taxing emotional day or month or year. And how do you combat that emotional roller coaster throughout the year so that you are even keeled for the parent and the child?
Well, plenty of vacations on my part. Just get out and drive and see the open country. I just love God's landscape. So that's my emotion. But we also have a great support system with our colleagues. We interact with one another. We have staff meetings, and sometimes we're able to address unusual situations with them and then help them ways we can discuss as a group, just an event that those situations occur again, then it wouldn't be a first time. So anything that's unusual, we try to support one another. And fortunately, the time of this communication era that we are going through, that's absolutely awesome, that I wish it was there when I was growing up. But we have this GroupMe app, and now we're able to communicate with one another on the spot. Hey, we got this scenario going on. Please advise. And then we get 5 or 6 answers. And then you can select the one that, closely to them aligned to the situation that you find yourself in and to your own values and beliefs, or your client's values and beliefs, whichever one that we're close aligned to that situation. And you can select from, at least they give you choices to expand your knowledge. And some people bring up things you don't think about. So that GroupMe communication app is absolutely awesome. I wish we had that years ago.
So definitely being able to collaborate with our coworkers or our colleagues, our other social work colleagues, or in collaborating with them, we all come from various backgrounds. As far as everybody has not always worked in a hospital. Some of us started at the Department of Human Resources, DHR. Many of us have working with mental health, working at the health department. So social workers, they come from all over. And we're able to collaborate with other social workers, and it helps to de-stress some of the situations or the traumas that we see. It just kind of helps to talk to somebody or someone who's kind of similar and who knows what you're going through, rather than family. Family have no idea. Family and friends have no idea. So they just look at you like you're a deer in headlights. And but when you're able to talk to someone who's been there and who's working the same things that you've worked, that's so beneficial, very beneficial.
Be able to kind of de-stress there at the end of the day or the end of the week and get on GroupMe and say, hey, I'm really struggling with this. What do you guys think? Or have you ever gone through this before? And to have those other, colleagues and coworkers chime in and support you there is a big thing. I think really that's amazing. Yes. As we kind of come to the end of our broadcast today, I don't want to keep you guys for too long here, but are there any skills and tips that you would recommend for other social workers for effectively advocating for children and families? Like a little tidbit, like, oh, this really works well.
Well, just knowing and having a compassion for people. That's really what drives, just being able to have a compassion for people, to know that, hey, we're here for you genuinely. And when someone can care less, we've all been through or had to deal with someone who who could care less about your situation. But when there's a social worker that genuinely cares, it shows. It shows, and the parents and the families, they see that. So just having empathy being able to actively listen to your families or to the concerns. And that comes with Social Work 100, being able to know those skills. So social workers are very highly skilled, trained professionals that can do that.
And we have knowledge in several different fields so that we can guide our clients to the proper solution or part of the solution, so they can get to wherever they are. And people a lot of times don't realize their own strength. You don't see your own strength within yourself, but sometimes it takes some steering to get them to see how strong they indeed are and help them empower themselves so that they can get through. And sometimes you have to walk with someone or hold somebody up as they walk through, especially when you get a new diagnosis of something devastating that has happened to your child. You're at your weakest point, and we come in and make sure that they're still grieved, but then bring their strengths out and then help them to make adequate decisions. And sometimes it takes a while for them to become accepting of whatever the diagnosis is. And sometimes those diagnoses, the good Lord has his own way of handling things, and the doctors wind up, not being as accurate. And sometimes God put his hands in and things turn out a whole lot better than it was anticipated. So you have to help people rely on their faith, their strengths, and help them guide through whatever this process is that they're headed toward.
When you're speaking about the empathy and the social cues, I imagine you could both walk into a room and look at somebody and be like, oh, they're thinking this or they're feeling that way. But being able to pick up on what people are, where they are in that process is pretty cool. And you guys have done that through experience. Yeah. Was there anything that we haven't talked about today that you would really like to say to individuals or family members that may have to go through being in a hospital and communicating with you in the future?
Definitely, probably in Alabama, in every hospital, there's a social worker. I would say if one has not come to you or you have not met one, ask for one. Ask for a social worker.
Well, very good. I appreciate you both for being on this morning. And we want to acknowledge everything that you do and Children's of Alabama does. There are things that happen for individuals and families, and to have the support that you guys provide, I don't think gets spoken of enough. I know for my family member, her social worker has tremendously helped her and the family. There are a lot of things that we knew nothing about, and she walked our hand through it. And even still, if there's questions I have, I'll call her and she will always be there. So, and my family member wouldn't be living the great life that she is if it wasn't for her case manager.
Wow, that's amazing.
And her family. She has an awesome family, obviously.
Yeah.
That's the ground. That's the ground. That's the foundation that's laid. And the family, if they are willing to be there to advocate for that family member who has that disability, then the rest of it, social worker can help you walk through life.
Mm-hmm.
Well, once again, thank you for being here, and we applaud you and everything that you do.
All right. Thank you.
You have a great day. Okay. It was a pleasure meeting you.
Same here
as well.
All right. Bye.